Hypertension. Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. Blood pressure is expressed as a measurement with two numbers, with one number on top and one on the bottom, like a fraction. The top number refers to the amount of pressure in your arteries during the contraction of your heart muscle. This is called systolic pressure. The bottom number refers to your blood pressure when your heart muscle is between beats. This is called diastolic pressure. When your systolic pressure is between 120 and 129 millimetre of mercury and your diastolic pressure is less than 80 millimetre of mercury, it means you have elevated blood pressure. Although these numbers aren't technically considered high blood pressure, you've moved out of the normal range. You will generally be diagnosed with high blood pressure if your systolic blood pressure reaches between 130 and 139 millimetre of mercury, or if your diastolic blood pressure reaches between 80 and 89 millimetre of mercury. This is considered Stage 1 hypertension. Stage 2 hypertension indicates an even more serious condition. If your blood pressure reading shows a top number of 140 or more, or a bottom number of 90 or more, it's considered Stage 2 hypertension. Approximately 90% to 95% of hypertension is idiopathic, so-called essential hypertension, or primary hypertension. Primary hypertension has no clearly identifiable underlying reason. Risk factors for primary hypertension include old age, obesity, family history, a salt-heavy diet, a sedentary lifestyle, heavy alcohol consumption, and smoking. A small number of patients, approximately 5%, are said to have secondary hypertension. Secondary hypertension results from an identifiable cause. Secondary hypertension can be caused by any process that increases arterial resistance, blood volume, and cardiac output. Thus, potential culprits are the kidneys, hormonal changes, changes in the blood vessels themselves, or drugs. Renal disease can cause failure to adequately excrete sodium and water, increasing intravascular volume. Additionally, stenosis of one or both renal arteries can lead to hypertension. This stenosis decreases blood flow to the kidneys, causing increased renin secretion. Renin ultimately helps kidneys retain more water. The water contributes to more blood in the arteries, making them more full, which leads to higher pressures. Renal artery stenosis can be caused by atherosclerosis or fibromuscular dysplasia of one or both renal arteries. Hormonal changes that can cause hypertension include hyperaldosteronism, increased cortisol, also known as Cushing's syndrome. When in excess, cortisol can stimulate aldosterone receptors. Hyperthyroidism, excess thyroid hormone increases cardiac output, and increased epinephrine and norepinephrine. Hypertensive crisis is an umbrella term for hypertensive urgency and hypertensive emergency. In hypertensive crisis, either the systolic pressure is greater than 180 millimetre of mercury or the diastolic pressure is greater than 120 millimetre of mercury. With hypertensive urgency, there hasn't yet been damage to end organs like the brain, kidney, heart, and lungs. In hypertensive emergency, there is damage to end organs. Organ damage associated with hypertensive emergency may include changes in mental status such as confusion, bleeding in the brain, heart failure, chest pain, fluid in the lungs, and heart attack. Do not forget to like the video and subscribe to our YouTube channel.